Timeout on time limits. Anthem BCBS reverses anesthesia coverage decision. On Across the Aisle News tonight, we are talking about insurance companies in the wake of the assassin. In an unexpected move, Anthem Blue Cross Blue Shield, Anthem BCBS, one of the largest health insurers in the U.S., announced it would not proceed with a controversial policy that aimed to limit the coverage of anesthesia during surgeries and medical procedures. The proposed policy would have capped insurance coverage for anesthesia based on specific time limits, causing a stir among medical professionals and patients alike. The original proposal. Anthem BCBS planned to implement a policy using physician work time values from the Centers for Medicare and Medicaid Services, CMS, to determine the maximum time for which anesthesia would be covered. This would have directly impacted patients in states like Connecticut, New York, and Missouri, where the policy would have been enforced. Exceptions were noted for maternity-related care and pediatric services for those under 22 years old, but for the majority of surgical procedures, this cap could have meant additional costs if treatments exceeded the insurer's set time limits. Public and professional backlash. The policy drew immediate and strong condemnation from the medical community, particularly from the American Society of Anesthesiologists, ASA. They argued that such a policy could not only compromise patient safety by rushing procedures but also saddle patients and providers with unexpected financial burdens. Social media was abuzz with criticisms, with many highlighting the potential for patients to receive surprise bills. Public figures, including state officials, expressed their opposition, prompting a broader debate on healthcare ethics and cost. The reversal. Anthem BCBS quickly responded to the backlash by announcing the policy would not move forward. In their statement, they noted, "There has been significant widespread misinformation about an update to our anesthesia policy. As a result, we have decided to not proceed with this policy change." They further clarified that it never was and never will be the policy of Anthem Blue Cross Blue Shield to not pay for medically necessary anesthesia services, aiming to realign public perception with their intent to merely clarify the appropriateness of anesthesia use according to clinical guidelines. Implications and future outlook. This decision by Anthem BCBS could set a precedent for how insurance companies approach coverage limits in healthcare. It brings to light the delicate balance insurers must maintain between cost control and quality of patient care. Discussions are now underway regarding potential legislative changes to ensure patient care isn't compromised by similar future policies. Other insurers might also reevaluate their coverage strategies in light of this public reaction. Sources cited. Anthem Blue Cross Blue Shield's official statement on the policy reversal. Reactions from the American Society of Anesthesiologists. Comments from state officials involved in the pushback against the policy.